we want to thank you guys for, coming around and seeing our presentation. We've been here for about 2 months, and you guys have been very welcoming, so we really appreciate that. While we were here on the metabolic unit, we did notice something that could use some quality improvement, which indeed was the pressure injuries. So we're going to get into that. My name is Kayla.
I'm Leandre.
And I'm Ashley.
And here we go.
Alright, I got it. So, like Kayla said before, the main issue to be discussed was pressure injuries. We noticed over the past 2 months how patients would develop these pressure sores due to lack of turning or other issues from different hospitals already having them and it's progressively getting worse. So we discussed how we could probably better implement something would be due to like the lack of turning scheduling that we have. I noticed that on the pressure chart that we have a turn clock, but we just thought it would probably be a better idea if having a turn clock with either within the rooms of the patients or on the outside that kind of forces people to acknowledge the fact that they need to be turned. And then development of a skin care item list. This list is in development in order to kind of incorporate how, if they hit a certain criteria of how more, what's what I'm looking for, risk they are, then they have specific items already set for them. So instead of having to go dig them out individually and then just have it already in their room. And then time management and delegation, because we're all a team, it wouldn't be fair to have one group of person or people to expect it to do the turning when we're all working together.
So why we decided on pressure injuries, this is just a national statistic. Hospitals acquired injuries cost patients upwards of $11 billion yearly, patients and hospitals. And this, for pressure injuries alone, can range from $500 to $700,000 per wound. That's per wound and all of the materials and time and labor and everything that it costs to help fix it. So we want to try to stop it before it gets to that point so that it's more beneficial for both patients and the hospital. It is one of the most preventable issues that hospitals are facing because there's not a lot of extra implementation that needs to be done to like fix it, just turning them on time. But when you have a bunch of other stuff that you have to do and everybody needs meds and pain meds and everybody needs to get clean, it becomes a lot. So similar QI projects done across the nation. There was one that was done in California last year. They implemented turn clocks in all of the patients' rooms due to a certain set of criteria, which is ours is similar to. It's kind of a mix between 2 studies that I've found. And they had up to a 50% decrease in hospital-acquired pressure injuries. And so hopefully we'll get that for you guys as well. So hopefully we'll see an equal amount of decrease. There's always room for improvement. Everybody can do everything, as a team better. And there's also high-risk patients. As we know, pressure injuries, they can happen within 2 hours. So if a patient's, laying on their side, on their right side for, upwards of, 8 hours, they could just start developing that pressure injury on their hip because it only takes 1 to 2 hours, and it may not be visible all the time because that first stage is that non-blanchable redness, and that's not always caught as soon as it should be sometimes. So we want to catch it within that 1 to 2 hours, which is why the goal is to be turning every 2 hours.
So the strategies to implement was upon admission. So the first thing is what we could do is we already know that we do a grading scale. With the grading scale, you get to assess to see how much of a risk a patient will be at developing pressure injuries. And based off the grading scale, we will implement the turning clock. And this is what, thanks to Ashley for developing this, it's kind of nice. A turn clock, which is we put in the patient's folder or charting, so that way you would know that this is something very important to put in their room, so that when they go into the room and you could just check, depending on what time it is, if they need to be turned. Post the person's room, and then level risk bundle, and as I said earlier in the presentation, that when you develop the risk, go with the grading scale. The next slide will go into more detail about it. Certain levels or different numbers will indicate how many items will be needed in these bundles. Here.
So upon admission, the grading scale is completed every single time upon admission when a patient gets here. If the score is lower than 18, which is technically a mild risk, 15 to 18 as a score, that's when all of these will be implemented. We're also going to implement it if the patient is immobile. So even if they don't score below an 18 for some reason, but I believe if they're immobile, it's kind of impossible. But if they are immobile, this is also going to be implemented, because then they can't move on their own and they can't, move on their own. So you're going to have to be turning them every 2 hours because they can't do it on their own. And then if the patient is nonverbal, because even if they are mobile and they're A&O times 3 and they have all of their faculties about them, if they can't communicate it with you that they are experiencing discomfort in an area on their back or on their side because they've been in the same position for a while, you're going to want to implement it for those nonverbal patients, just because it's harder for them to communicate their discomfort and if they haven't been turned in a while. So in our skin breakdown kit, again, it's going to be for every admission with a Braden scale score under 18. The Alevins you guys already use quite frequently, so that's going to be in there, along with waffle mattresses and waffle boots. Obviously, you can't put those in the physical kit themselves, but they should be in the patient's room. Something important to note with the waffle mattresses and boots is that they should be placed properly on the bed and the patient, because say you put a waffle boot on a little bit crooked and the patient is now laying on them, the holes in the waffle boots themselves and those edges can cause pressure on the foot, and can end up causing more injury than it would if you weren't going to put it there. So we have to just make sure that we're putting it on properly, nice and snug, and then the patient is going to be sitting with those feet, not, trying to rub and push, so that we don't make the injury worse, and the item that we're using is actually helping. We're also going to use protective cream and personal cleanser, because if the patient is incontinent and they're sitting in their stool or their urine or that's sitting on the skin, you want to make sure that that doesn't cause a risk for breakdown, because it'll make the chances of getting a pressure injury that much worse. Also, wedges are extremely important as well to use in the turning. Pillows and things like that that aren't necessarily a flat surface can cause wrinkles on the patient's skin, can cause bunching, which is a higher increase of pressure injuries. Pillows also sometimes aren't the most stable and they can be uncomfortable for patients. If able to, the most ideal situation would be to use 2 wedges, one on the upper back and then one on the lower, towards, just beneath their buttocks, so that there is even pressure along the entirety of the side of the body, so that the body isn't turning and bending in odd positions that would cause more discomfort for the patient. Also with the waffle mattress, if the patient is completely immobile, scoring either a 1 or a 2 on the Braden scale, the ideal situation would be to get them a low air loss mattress, because then they're not turning at all. They're not even moving. Micro movements aren't even as much there. So the low air loss mattress would really help with that. Okay, so the turn clocks that we made them blue because we noticed that a lot of the things that you hang up on the outsides of doors aren't actually blue. So we thought blue would be something that stood out. It's going to be just a reference to use, so ideally it would be on the outside of the patient's door right next to the rounding sheets, because that's what it's going to be used for. You guys have the section where you can say whether the patient is self on the right, left, or back, and this would kind of be used as like a handy reference, so that you didn't really have to think about it as much, and not as much brain power had to be used on remembering whether the patient's been turned, how long they've been on that particular side, because you guys are already filling it out as a part of your already regular nursely and PCT and everybody duties. So it's already part of that. So this is going to be kind of just a reference to use. And the turning, obviously, as you guys would know already, is going to be tolerated by the patient, because sometimes moving them hurts the patient. So if you can't move them completely and totally, even micro movements help. So even if they're still on their back, as long as they've shifted their weight from their right buttocks to their left, that can help just alleviate the pressure from their right side to the left side, even if you're not fully turning them.
So I added skin breakdown is that I wanted to add a quote saying pressure injuries can develop quickly, and sometimes as little as several hours without movement. This is just to collaborate with what Ashley said earlier, but it can happen between 1 and 2 hours. And it was just important to know how quickly this can happen because, like I said, we all can get busy with doing what we need to do with charting, or maybe like an emergency, but try to get there as fast as you possibly can. And then, like I said before, having these clocks and knowing what side they are on and what side to turn them to can help with figuring out how to prevent the pressure injuries.
Okay, so help and delegation. Like we said at the very beginning, this is going to be a team effort and everybody needs to be involved with it. So always ask for help if you need help turning a patient because again, the point of this whole project is quality improvement for patient care. And you want to make sure that the patient and you as the nurse, LPN, PCT are making sure that you are safe as well. So if you're not able to turn the patient on your own, make sure that you have help because if you end up trying to turn them and you get hurt yourself, it's not going to be an ideal situation for anyone. This task can be delegated if need be, if you are extremely busy. But again, team effort and priority is safety.
All right. To kind of wrap us all up, kind of want to talk about this evidence-based practice article that I found. It did a study where about 1,300 patients were split, one control group and one non. Half of the patients had sensors on them, and the sensors allowed, like, every 2 hours, it would, like, alert their nurses, basically, to come in and reposition them. And you see the 67% compliance rate with that, and an improvement within skin injuries, pressure injuries, and the healing was adequate afterwards as well. So for patient outcomes, we obviously want timely turning for inhibiting skin breakdown and further developing the pressure injuries. It also is good for preventative measures, and you want to use that with the Braden scale for high-risk patients. Also, timely turning and positioning can assist in adequate healing process, which we talked about, but it also just integrates good quality patient care, allowing your patient to know that they matter and they're getting the best efficient care possible. All right, so recommendations for future quality improvement. So although we've been talking a lot about this turn clock and coming in every 2 hours to turn your patient, you can also take action with adequate nutrition with your patients, increase fluid intake, proper sheet placement, so no wrinkles, no wrappers, nothing underneath the patient that could cause friction and shearing to increase the risk for a pressure ulcer. And also the proper elevation of the bed. You don't want it above you don't want it higher than 30 degrees because that also might cause the sheets to shear and a higher increase of the pressure ulcer as well. And last but not least, communicating these orders with the providers, such as like a low air loss mattress. Sometimes it might be hard to get this implemented with a patient specifically, so just making sure communication is good there. And these are our answers.
Yeah. Thank you.
Does anybody have any questions?
Comments or concerns?
Nope.
No.
Great job. Thank you.